they walk up, I can say a word about their bios. And what I'm going to do is just, do I push it? Yes, I do. Sorry. I'm going to say the things you don't already know about them.
Something's on the internet.
No, I actually happen to have known this, and that is that both Paula and Paurvi worked for CARE.
That's right.
At one point in their past. And David, you do know, was an emergency physician. And so what we have on this panel is not just three people who are playing very effective roles in three very important companies, but you also have people who started their careers with the concept of service. And what's interesting to me is how they are combining the values of service with the tools of the corporations they come from. And so I just, that was the piece that may not be in the bios. I actually haven't checked the bios, but it may not be in the bios. Paula, I'm going to start with you because you do have such a clear definition, and you do, I mean, there's great discipline in Hess about CRS. To give us a sense of some of the work that you're doing and how it relates to your company's understanding of corporate social responsibility.
Sure. For those of you, technology is not my forte, thank God. I'm next to Paurvi. Basically, to borrow a line from Indra Nooyi, for us at Hess, social responsibility isn't about what you do with your profits, it's about how you make them. It's about operational and corporate excellence and driving certain behaviors through the line. For us as we're an oil company, for those of you who don't know us. Those of you on the East Coast may know us from our Hess toy truck, which is now available online, but enough of my plugs. But basically for us, we're an oil company. We don't own the oil and gas fields. So for us, you know, the real foundational element of our CSR strategy is stakeholder engagement. Why? Because we rely on stakeholders to access the resources that we develop. And you know, it's not a social license to operate issue for us, it's a license to operate issue. If we don't maintain and cultivate strong relationships with national oil companies and governments, regulators, and landowners in a place like the US, it's game over. You don't have access and you don't produce. So that's terribly important. And given, you know, our presence, particularly when we're onshore, we have tremendous social and environmental impacts and potential impacts that we have to manage well in order to retain our license to operate. So social and environmental risk identification and management are critically important, not just from a reputational standpoint, but from an operational standpoint. Tremendous, you know, we can point to real dollars in terms of potential value erosion when we don't get things right. You know, we know, for example, if a community is unhappy with us and shuts us down, we know what that costs every day we're shut in, whether we're drilling in deep water or positioned to do seismic analyses. So there are real consequences of not managing that well. You know, reputation, of course, is one that I didn't even really touch on. The third area for us, and I think it's very connected to, you know, both stakeholder engagement and the risk aspect, is social investment. And there, you know, we had a very traditional philanthropy approach when I joined the company 8 years ago, and have slowly over time moved to a more shared value approach, and really, you know, are focusing on how can we not only utilize philanthropy dollars, which will always be part of the mix, but how do we best leverage the core activities of the enterprise where there is some implicit social value being created and where we can you know, gain a better understanding and better metrics around the business value, because that ultimately is what's going to sustain the effort. So that's how we define things.
Talk a little bit more about social risk, because obviously an oil spill, something like that, is an enormous setback. But what are the other considerations of the populations that where your operations are?
Sure. I mean, again, it depends, but human rights, broadly defined, are a huge issue for the industry, right? They have been. There have been some stellar violations of human rights by the oil and gas and mining industries over this last several decades. And so, for us, really that's been a mainstay of our work, figuring out how do we handle our relationships with security, terribly important, whether it's public security forces or private security forces. How do we communicate our expectations regarding their behavior with the communities we serve? And so that's a terribly important thing. And also internally, as the company's footprint has become a little bit less emerging market and more U.S., maintaining internal understanding and support for work and human rights. We have just rolled out a new and improved human rights training program for all of our employees. And when we were about to roll it out, we had business folks saying, why do people in North Dakota need to be trained on human rights? Well, trafficking in persons happens everywhere. It happens in North Dakota. That might be why there were several bills in front of their legislature over the last several years on the issue. Human rights are really about what we try to do as CSR professionals, and that's make sure that our companies maintain a positive relationship with society and that we are treating people according to the golden rule. So that's...
And corruption is a big issue for the industry, the places where it operates. What is your approach toward transparency?
First of all, we're very transparent in our disclosure. We've been doing a sustainability report to GRI standards, and even since predating GRI standards, for many, many years. And Hess, while we're not perfect, we do get a lot of recognition for our level of transparency and disclosure. I think that's important to share both the good things and the challenging things with your stakeholders, and it keeps you honest internally. So I think that's important. And the other thing is we have very strong, and this sounds like a business sort of solution, we have very strong processes and an accountability framework around how we conduct ourselves as a business. We operate in some very difficult countries, and have, I think, gained the respect of colleagues in those countries for our steadfast adherence to things like the FCPA.
Are you in Nigeria?
No, we're in
Burma?
Equatorial Guinea.
Okay.
And Ghana. Yeah.
And
I
Ghana,
heard a
yes.
gasp.
And then as you think about your own accountability, you're talking about the company's accountability to community and to broader international norms, but as you think about your own accountability as the effectiveness of your corporate social responsibility is measured, to whom are you accountable?
We're accountable to senior management, to the line leaders, obviously to the board of directors. It was interesting when I was hired by Hess, the senior management really wanted to build this function. And what they said to me was, look, for us, we see this as a competitive advantage for a company of our size. Mm-hmm. We're not Exxon, we're not Chevron, and yet we are competitors with them for access to the same resources. I think the other unique thing about Hess is the person who is CEO is the son of the founder, and his name is on the door. And when you're someone like me leading a corporate social responsibility function, to have a CEO for whom personal and corporate reputation are inextricably linked, it's a very powerful support. And so I think that makes the company a bit unique. It is really part of the DNA of the company. John Hess, I don't know how many of you know him, he's an incredible individual, and he has said to me many times, at the end of your life, no one's really going to care what kind of car you drove, whether you lived on Park Avenue or in the South Bronx. They're going to care really what did you do with the 80, maybe if you're lucky, years God gave you to walk this earth, and what positive legacy have you left? Mm-hmm. And he really believes that, and he certainly runs his personal life that way, and he wants the company to run that way.
I'm struck by as I mentioned earlier, and you've touched on, the degree to which you all are focused on international norms and being a player in that space. So I wanted to turn to Paurvi because not only have you all embraced the UN Compact, but Paurvi, the goal actually that you set for the foundation is the same as the World Health Organization's goal when it comes to non-communicable diseases. So talk about your work, but also how you relate to an international community as part of it.
Sure. I lead access from the perspective of strategic investments from the philanthropy. And just to set the stage for that, as I pivot to the question that you're asking, the way that we look at philanthropy is in a couple of ways. The traditional ways that I think everyone in this room is probably very familiar with, which is matched giving, charitable contributions, volunteerism, and that's one part of what our company does, donations of products. And that's not the part that I focus on. The part that I focus on are around strategic investments. And it's really moving from a passive approach in philanthropy into something that's much more active. So it's a strategic partnership with the resources that we have to offer with a variety of partners on the ground. If we're looking at deploying any of our expertise, it's really in technical sharing and not as volunteers. And even when we think about our products, it's really to unlock a more efficient system that we can bring together. And so the reason why I start there is because it does all land on a larger goal. And that goal being tied to something that all of us in healthcare are trying to move towards, which is a WHO set standard, and now a set of SDGs. That doesn't just give us currency as an organization. Granted, we are in a healthcare company, so we care about all of the things that need to happen for any health goal that's out there. But in a situation like non-communicable diseases, which is the area that our company focuses on, as well as a new area in global health, we have a particular interest to make sure that we set the pace and the standard for what can happen in that area, and to really lift up a WHO goal, because it's the first goal for that set of diseases. The architecture for global health today rests on communicable diseases, as you mentioned, as well as moms and kids, but it's not at all set up to handle what we've all saw the data from our colleague from IHME. And so we felt very strongly that anything that we would do in being a leader in this space would be in service to this higher order WHO goal. We know that we can't attribute our work to a goal like that, but we know that the fact that we are choosing to lift it up to an international standard allows us to really bring others along, and also allows us to bring some expertise to the table. We have kind of almost surgically brought in people from the communicable disease area. I come from the HIV movement. Our leader of our philanthropy also does, and we have some public-private partnership experts that also come from the same area, and it's mainly to accelerate so that we can get to that goal.
So I described it, you actually turned to the notion of partnership. Can you mention a couple of the partnerships you're in right now?
Sure. So as we're moving towards this larger goal, it became really clear, and as we all know, ODA does not exist in the non-communicable space, which is, it's very, very thin, if at all, there, overseas development assistance. And so for us, it's incredibly important that we partner with local government, for sure, but in doing so, we have global partners that we rest on to be able to navigate that well for us, because a team sitting in Minnesota or in Washington inside of a company is not going to steward in the best possible way what needs to happen on the ground. The way we set the table for our partnerships is really through a staggered set of advisory groups that are made up of local governments, but not only that, people who are affected by these conditions, which you'll be surprised to know, again, if coming out of the health fields that we know from the past, a seat at the table has been hard won, but is always there, especially in HIV, women's health, but it is not at all there for non-communicable diseases. So we make sure that that's a part of an advisory step, as well as the front line who deliver care, together with other experts as well. We do that globally, locally, and all the way down to the specific geography where we're providing our support. We make sure that partners like IHME, who is one of our global partners, deliver on the data that's necessary in a very objective way to determine what's the baseline today for underserved communities where cardiovascular disease and diabetes exist. And we reflect that data back to these advisory groups. They determine what needs to happen next. They determine the competitive process to bring the best ideas to the table. And just like our colleague mentioned earlier, what Mark mentioned earlier is, writing a check isn't innovative, or is it strategic? And so we actually take that same point of view. We don't just write a check. A lot of the work that we're doing is stewarding those advisory groups and really building out the partnership with local government so that we're able to use our resources to unlock some more of their resources.
And your real strategy, though, is around health system strengthening. So talk about the sort of successes and failures there, and what gets in your way, and what are the opportunities you can see?
Sure. So we look at the continuum of care. And in healthcare, that's basically the doorstep of people who are in need of care all the way through to tertiary care, and then when they come home. Our part as a philanthropy in that continuum of care is the doorstep through to primary care, because we know that 80% of healthcare happens at home. And so for us, our effort is to lift up the infrastructure that is needed at that piece. And that's what typically gets in the way, because in these disease states, there is no infrastructure really that's in place for people that are in community. That said, that infrastructure has been built up for maternal child health, family planning, HIV, TB, and malaria. So whatever we can do to layer into what already exists is what we need, is what we do. And how that relates to health systems is that we're also thinking through how to task shift so that people who are needing to have care closer to home are able to get that care, whether it be through an informal caretaker, a traditional birth attendant, a pharmacist, an emergency health worker, or even a community health worker, and how to help legitimize those roles in a way that's productive for these disease states, and then strengthen the referral chain, so if it's needed, that someone needs to move up to tertiary care. Our company, GE, any of the other businesses that are really trying to shore up clinical care are brought into the same continuum so that we're really going end to end. Because as you nicely outlined what the difference is in corporate philanthropy, we do need to stay about a step removed from what the direct business is doing. And the way we get around that is to really stay close to what's happening closer to home.
And when you talk about the continuum of care, it's through the perspective of the patient, is that
Yes.
right? It's that patient's journey.
It's the patient's journey.
So just say a word before I turn to David about this concept of patient voice. You've written a lot about elevating patient voice
Yeah.
for a variety of reasons, one of which is that they can teach others. But tell me what your approach is to that.
Yeah, we feel, well, first of all, we don't think patients call themselves patients, none of us. I'm sitting here as, after having heard all of the beratement about health and wellness at work, I'm here coughing away. So, yes, we work hard and we need to take care of ourselves, and I don't view myself a patient today. So a big piece of what we do is really bring forward the person-affected point of view, which is not only the person directly who's affected, but also the next ring around them, the caretaker. And not just their care journey, but their empowerment journey. And the empowerment journey isn't just the care that they need to seek. And why it's important to punctuate that is it allows us to flip from what can seem like a very disease-oriented, let's just screen people, get them into care, and get them home, which can be very, very passive, because I can grab this room, screen you all, provide something to you all, and you can go home and get sick again. Nothing has really changed, but from your point of view. So an empowerment pathway is really much more active, which takes people through care-seeking behavior and for themselves, then moving forward to let others know, and then going even a step beyond that to start giving back to society. So much like John Hess for Hess, we have Earl Bakken, who's a founder of Medtronic, and he's still with us today. He's in his 90s, and one of the biggest challenges he's given to our team is to really come up with a way for people who've benefited so much from pacemakers, frankly. That's the beginning of our business, who've had all these years given back to them. How can we really recognize people who now, because of those extended years, are giving back to society? And so we have an entire program that is around the person affected and awarding those that have actually done great work back into the community. So it's a continuum that's of a different sort, which is a continuum of empowerment that takes people from knowing more about their own condition, educating others, staying healthy themselves, and then giving back to community.
So David, I sort of described GE as the ultimate shared value company, or one that seeks to have social benefit be intrinsic to the value chain. What does that mean for somebody within the foundation? Do you interact with those efforts? Are you the metrics maven when it comes to social benefit? What is the relationship there? And tell us more about what you do.
Sure, it's a great question. So before I answer the question, just two preliminary comments. First of all, I gave my son his 27th Hess truck this weekend. He's got them all.
Make sure he has the boxes.
Yeah, he does have some of the boxes. Yeah. Exactly. So You know, in terms of what I do, as Jane mentioned, I work for the GE Foundation, but I do want to mention a couple of things about what GE has done from a shared value perspective, which you alluded to. The one I'm most familiar with is Healthy Imagination, which was a commitment that was made in 2010 to invest $6 billion in reducing cost, improving access, and improving quality and care, each by 15% by some metrics. And we've now, to date, I think the number is released about 100 products that are independently certified as Healthy Imagination certified by an independent auditor that we don't actually review. So there was a real commitment that actually truly produced. You mentioned the ECG machines. There's another several dozen products that have been released with the Healthy Imagination label with the goal of reducing cost and improving access and quality. The second part of that initiative around shared values, eco-imagination, which I'm much less familiar with. My colleague Ben may know more about it, but I'm less familiar with eco-imagination and the investment portfolio there. But again, the same idea of looking at the environment, making sure that our businesses are environmentally sensitive and that we're reducing our carbon footprint rather than increasing our carbon footprint. The next leg of the shared value stool is, in my view, what we do at the foundation, which is initially, or has been historically, philanthropy, purely just donation philanthropy through matching gifts, through scholarships, and some other programs. And then about 10 or 12 years ago, we got much more programmatically involved both in health and education, and now have robust programs globally in health and domestically in education. Paurvi mentioned the idea that foundations need to stay at least one step removed from the business. And when I came to the foundation 2.5 years ago, we started to question how big that step needed to be. How big does that wall need to be between what the foundation does and what the business does? Because quite frankly, we felt limited by what our impact and sustainability could be if we didn't leverage this enormous organization that we were partnered with. When we talk about partnership, and we really now have developed a strong partnership between the foundation and the commercial businesses, whether that's healthcare or other businesses, helping us to be impactful on the ground. So as an example, we just launched a Safe Surgery 2020 initiative. So the need for safe surgery, as many of you may know, around the world is extraordinary. 5 billion people don't have access to surgery. 16 or so million people a year die globally because there's no access to safe surgery. The economic consequences are extraordinary as a result of limited access to safe surgery. So we looked at that problem. We looked at what our core competencies were and our capability and what some of our product portfolio is, the way we think, some of the work that we've done, and said, you know, we think it makes sense for us to be focused on safe surgery. And so as a foundation, we put together a program that we believe is going to be impactful over the next 5 years and really help to begin to make some changes in the surgical ecosystem in low and middle income countries. But we couldn't do that without partnering with GE. And we really looked at this and said, they're looking at the continuum of care. We're looking at the continuum of care. How do we begin to tell this or act as a one GE environment where philanthropic dollars are being used appropriately, but also the commercial capability, the expertise that we had across the businesses, the work that the businesses were doing would enable us to do safe surgery from a much more impactful way, a much more strategic way, and quite frankly, a much more sustainable way on the ground for the countries we're working in. So we've kind of transitioned from foundation over here, GE over here, and truly established, you know, we talk about public-private partnerships. This is an internal industrial partnership to be able to have the greatest impact we possibly can.
So you're talking a bit about partnership within the company. Talk also about partnership with other private sector organizations.
Yeah.
If you wanted to get together with someone else on this panel, what would you be doing together and how would you go about it?
Paurvi and I have talked about this a lot already. For over the last 2 years, we've been talking a lot about how we figure out a way to partner together. You know, we talk about public-private partnerships. I actually think we ought to think about public-private, private-private partnerships. And that is bring multiple players from the private sector together to do something impactful. You know, whether it's Medtronic and GE aligning and figuring out something to do. GE and Hess, right? You know, it doesn't have to be in healthcare. We can partner with oil companies as well. We can partner with IT companies, with communications companies. It's important that we think about ways that the private sector can come together. I actually think we're probably more trustworthy. We talked earlier today about the idea of trusting the private sector. I think we're more trustworthy as a private sector if we come collaboratively as opposed to competitively. I think there's an idea that if I'm going in some space and Medtronic's going in separately, just to use an example, that we're going to go for each other, for our own advantage and not partner together. If we go together, the other people on the other side of the table will say, well, maybe they're not really competitive. Maybe they really want to do social good because they're coming together. So I think the concept of partnering across private sector is really important. It's hard to figure out because what's the value we get back with those partnerships? Who shares the limelight when you do these private-private partnerships? But it's incredibly important to do it. I'll give you one example where we've started, and Jane and I have talked about this previously, about do we have success stories? I can't give you a success story in my short career with the foundation, but I can tell you one thing that we're doing that I'm pretty convinced will be a success story. We're talking about the global, the international health regulations. The global health security agenda is something that was started about almost 2 years ago now, to address pandemic and address epidemic and address global health security. It's 60 countries targeted. I think 45 have already signed up. But there was no private sector engagement. It was government, it was academia, it was civil society, and no engagement with the private sector. When I first started getting involved with Ebola, the Ebola Private Sector Mobilization Group got together to respond to Ebola. It was a collaboration. And we looked at that and said, why can't the private sector do this continuously for disaster preparedness, for addressing global health security? And in May, around the time of the World Health Assembly, Alan Tenenberg, who's at J&J, and I got together and said, you know what, we really ought to think about how we can do this and seriously take action for the private sector in addressing the global health security agenda. And we just recently, it's not formalized yet, but we're pretty close to formalizing the global health security agenda private sector roundtable, where we will directly interface with the global health security agenda on a program-by-program basis to be prepared for the next pandemic and also to help build the global health security agenda to prevent the next pandemic as well. So there's a starting example, but it's going pretty well. We have 20 companies that have expressed serious interest.
So I may be the only person in the room that doesn't know what security means in this context. Is this a way for the Obama administration simply to say, it's really important, we'll call it a security issue, or are there really attributes that are the same? Is it about using intelligence assets to know about a spread of disease? Is it about mobilizing on the ground? Is it about logistics? All the things that national security is my background, so all the things that national security is about?
I think it is. I think it is all those things, because as we experienced in Ebola, there was a lot of fear about Ebola, not just because of the disease itself, but there was a security issue in terms of global security. Were we going to shut borders? Were we going to leave borders open? Economic security was impacted by Ebola. And I think to the president's credit, he actually thought about the global health security agenda before Ebola happened. I think Ebola gave it a lot of fuel and really energized the movement to make it quite serious. And as I said, 60 companies initially signed up. I think 45 have officially signed on to this. It was led by Finland for the first 2 years. It'll be led by Indonesia next. So it's not just a U.S. initiative. It's a global initiative.
Right. And the reference to Ebola brings to mind, for me, the question of why did things go so badly in those 3 post-conflict countries and actually go pretty well in Nigeria? And where, right? I mean, it was able to contain it.
It's all systems.
It was all systems.
It's all the ability to have systems in place to address it. In fact, in my view, there were 3 recent cases of Ebola in Liberia. It was Ebola-free twice. Now they have 3 more cases. The reason it's only 3 more cases is because they now have a system in place. As small as that system is, there is a system in place now to recognize it, to contain it, to look for other cases. And I don't think we'll see an outbreak like we did last time, because there is some level of system in place.
But interestingly, in the case of Nigeria, there was a situation in which, because of the polio fight, right? Because Center for Disease Control, WHO, UNICEF, Gates Foundation, Dangote Foundation had all committed those kinds of resources. Those clinics could just be repurposed.
Right.
So it's just a reminder of the importance of each actor playing a role, even in a state as robust as Nigeria by comparison. Take us back home, because there was a great question from a gentleman from Cincinnati about disparities, and of course, unfortunately, we are in a society where health outcomes do have a lot to do with where you came from. But wasn't there at one point a partnership in Cincinnati that GE was a part of? Is this, tell us about that.
So it's a multi-level partnership and multi-elements to it in Cincinnati, but also other what we'll call GE cities around the U.S. So we have round numbers, 120,000 employees in the U.S., about 22 cities where we have at least 500 employees. And there are business leaders in each of those cities who are committed to their communities. And Cincinnati is a great example where David Joyce, who's the leader of aviation, is committed to the community of Cincinnati and has expended a lot of resources from not just cash and in-kind contribution, but has asked his employees to volunteer their times in schools, in clinics, where they can bring what we call the GE DNA into schools and clinics and help guide some of the leadership there on some of the things that we were talking about in terms of business processes and making them more efficient, making them think about business differently, bringing some of what we use like lean processing and Six Sigma and now what we're calling FastWorks into some of those entities. We've invested, I don't have the exact numbers, but I can tell you it's in the tens of millions of dollars in Cincinnati, both on the education and health portfolio, to try to enable some of the improvements there.
While we were talking about health system strengthening, I did want to get back to Health Rise, if you could tell us what that is.
So Health Rise is a multi-year, multi-million-dollar effort that is one of these strategic investments that Medtronic makes in partnership with a variety of local governments, particularly in India, South Africa, soon Brazil, and in the United States. So it's a great pivot to what David was just talking about with Cincinnati. We felt very strongly that in the era of SDGs, which is basically we're all in it now, there isn't an industrialized versus non-industrialized set of thinking, that we really set the table for an effort that allows us to look across a variety of geographies in a very boundaryless way. And that is one of the hallmarks of what corporate philanthropy can do, which is different from what public donor initiatives can do, because we don't have to have as many of the, we have a lot of rules as well, but we don't have as many of the silos that some can have. And so HealthRise has efforts underway in communities near the Twin Cities, which is where Medtronic is operationally headquartered. And what we look at is, again, the barriers around a continuum of care, specifically in the chronic management of hypertension and diabetes. And what's been very interesting, our value proposition on all of this is that barriers for the underserved are likely to be very similar, no matter where you live. And the ideas that might be working in one community based in South Africa may actually be very germane to an underserved community outside of Minneapolis. And today, it's very difficult to be able to do that kind of cross-exchange. And so we wanted to set up something that allowed for that kind of freedom. What's been interesting about HealthRise is that we're also building off of the platforms that already exist for maternal child health and HIV, TB, and malaria, especially outside of the United States. Inside the United States, we're working hard to connect what might be happening in a healthcare system with what's happening in the community. We've actually flipped the model around, where I'd never heard of hubs and spokes until I came to Medtronic, to be quite frank, because I come out of public health. And so the hub is a community, and the spokes are all there to serve the community, and it's actually the other way around when you're inside of, more of the hard bricks and mortar side of healthcare. And so HealthRise also flips it around, and so the purpose of it is to set up interventions that are community-based that connect into the health system. The final point I'll make is it has been fascinating. We're already starting to see some results just on the needs assessments alone from our colleagues from IHME. When you look at a disease cascade, which is something that I think many of us may be familiar with from communicable diseases, we're seeing that, especially in diabetes, it's not diagnosis that seems to be the issue in some of these underserved settings. It's actually control and management. But when you look at hypertension, it flips around. And we certainly all know that diseases travel together, and so there's a lot of comorbidity that's happening. And the final piece that I'll add about HealthRise is that it's a very sharp eye on disparity, and disparity is happening everywhere around the world. Minnesota is known as a high-performing healthcare state, which is fascinating because when you pull the first layer off of what's going on in Minnesota, you see so much disparity. And we saw that earlier today in the maps from IHME. And so this allows us to really shine a light on that. And those disparities are happening right outside of Delhi as much as they're happening right outside of Minnesota. And this era of SDGs allows us to just humbly look at what's going on in our own backyard.
That would have been my question to Paula, is the degree to which things like the Millennium Development Goals and now the Strategic Development Goals and other UN efforts, the degree to which that provides an umbrella under which to mobilize and collaborate.
Oh, I think it does. I mean, the MDGs were developed within the confines of the UN with very little consultation and very much aimed at emerging markets. And now the SDGs, I think, lesson learned, the UN, really involved a broad array of stakeholders in developing those SDGs, and none of us are exempt, and all of us are, it's incumbent upon all of us to help the world achieve them. We've got to figure it out. The traditional paradigms of philanthropy are simply not adequate, as important as they are. I mean, you think that the Chan Zuckerberg news, terribly important, amazing that they're setting up an LLC, but $45 billion is a huge amount of money for me personally, but it's, at the end, it's going to take trillions. It's going to take trillions to achieve the SDGs, and we have to, really take collaboration to a new level. I like David's idea of private, public, everybody at the table. I think that's critical, and I think we have to really think about what we're trying to think about internally now is how do we leverage our core operations in a way that creates, value here, value for the shareholders and value for society. Because I think there's enormous power in supply chains and all kinds of things we do as, what we think of as, oh, that's just how we run our business, but there's enormous opportunity to contribute to the SDGs.
Well, there's this concept of impact sourcing, too. Is that something that you all look at, the notion of basically creating jobs where they are most needed by sourcing with that in mind?
I'd like to get us there. I mean, for the, the oil industry is part of our contracting. We're often required to source locally, engage in workforce development and localize our workforces. And it's all often, and for a long time, been a contractual obligation. I think the question is, how do we work with procurement folks who are not, they're well-intentioned, but they don't have this bandwidth in terms of skill set? How do we help our colleagues in procurement on the business side move beyond the traditional bidding, just looking at the least cost provider, or perhaps vetting for environment, health and safety indicators, and really look more broadly at, we can either create value by making grants to support education, or we can work with SMEs in host communities and figure out how we make them suppliers, and what's that going to take in terms of technical assistance and access to capital.
So just to, I hope that you're thoroughly confused, knowing that in fact, Paula, who's supposed to be about CRS, has actually been involved in shared value to some extent when it comes to the value chain. You're supposed to be just about grants, yet Medtronic has produced products of use to new markets. You're supposed to be a little of everything, Dave, which is really lucky because in fact we're watching you both making grants that are all about education in the United States, while your company is also creating products and looking at the way in which it does develop and deliver those products.